Hello, and welcome to Healthcare Matters, where thought leaders come to discuss the intersection of medicine and the law. I'm your host, Mike Matre, and today's guest is Dr. Jonathan Terry. Dr. Terry is a board-certified osteopathic physician and surgeon, as well as a general psychiatrist. Welcome to Healthcare Matters, Dr. Terry.
Thanks so much, Mike. I really appreciate the invitation to be on the show.
What are some of the other advantages of telemedicine to both the patient and the physician, and in what situations are these advantages more pronounced?
Really great question, Mike. Of course, we wouldn't be doing telemedicine if there weren't significant advantages for both patient and provider. For starters, when I train my staff in the technology, I'll tell them in general about the acceptance. Some might be fearful, the patient doesn't want to be seen over the TV, something like that. And I'll cite several studies showing that patients who see the doctor over telemedicine, as opposed to the same doctor in a face-to-face study, will perceive that provider as being, first, more knowledgeable, and second, as having spent more time with the patient, which I think are two great things for a fragmented healthcare system. One of my favorite things, though, that I have to say about telemedicine, really, and the main reason that I use it in my practice, is for improved access. It can, of course, expand the reach of our providers beyond the walls of the clinic, beyond the walls of the hospital, bringing healthcare to the home, the school, the rural community, the island, to international recipients, things we couldn't do before. I do, in my experience, I do consultation psychiatry now for a migrant health center and a federally qualified health center that covers 3 counties in rural Central California. So in one day, I might see patients across 13 clinics, a nearly 200-mile area, all without leaving my office. Every single one of these patients is somebody who comes from an underserved background who would have just tremendous difficulty in having the same sort of access with a local provider. On a similar note, I'll mention, telemedicine is highly cost effective. There are several studies that point at reduced healthcare costs, something we're all concerned about, through adoption of telemedicine and the efficiency that comes with it. The neat thing about this is while we used to require sort of specific technology for telemedicine, now we're doing it with our tablets and with mobile phones. There are a number of clinics that are doing just using secure software that way. And with telemedicine, of course, a third thing that I might mention is it's reasonable to believe we might be accepting convenience in exchange for some sacrifice in quality. And, I think that's a valid concern, but, the data just doesn't show it. It's interesting. It shows the exact opposite. In many disciplines, telemedicine's actually been shown to offer a better product with higher patient satisfaction and similar, if not better, outcomes. The last thing I might mention, and I know there's a lot to say about this question, is patient demand. And I think about this in terms of we can now stream new release movies to our home. We can have packages delivered the next day. So I think a lot of our consumers are saying, why do I have to go to the clinic and take off work to go to the doctor's office? So telemedicine, of course, it has its role in highly underserved communities, but maybe even in our urban environments for the working customer, patients, families, communities, even employers are really figuring out, okay, how can we make this technology work for us to make healthcare more accessible?
Thank you for your time, Dr. Terry.
My pleasure, Mike. Thanks so much for having me on board.
One of the most important elements of ethical care is to get informed consent from your patient prior to beginning any course of treatment. Is it more difficult to achieve informed consent via telemedicine setting than a traditional office setting? And if so, how should a physician practicing telemedicine alter his or her approach to achieving informed consent?